right, next up we have Anna Laucis, University of Michigan resident, Duke fan, Twitter heroine. She's here to talk a little bit about a pilot wellness initiative for radiation oncology residents. 2-year update.
Thank you so much. Thanks everyone for being here and for having me for this talk. So I presented sort of the first year result last year, but I'm here to give a 2-year update on a wellness initiative that I've started at the University of Michigan. So just a little bit of background. I'm sure everyone's familiar, or at least has heard about provider burnout. It's a huge issue affecting providers, not just physicians, but really anyone in healthcare and in many other specialties as well. Trainees in particular are at high risk of burnout. There have been some big articles in JAMA and other big publications about this issue leading to suicide sort of at the most extreme. I think some of the contributing factors, of course, there's a huge documentation burden. Using EMRs, they can be great for seeing records for lots of patients, but it can be challenging to finish all of those notes. Sleep deprivation, of course, with long hours. Emotional exhaustion, just in particular for radiation oncology, even working normal hours, just a lot of the conversations we have center around death and dying or really serious issues. Fragmented teams, rotating gives us a lot of exposure to other sites, but you're always working with different attendings, meeting different expectations. That can certainly be challenging. And just very recently I read an article about sort of this always-on culture and how that actually can contribute to gender disparities as well. Sort of in similar vein to what other folks have talked about, I did a pre-assessment and sort of ongoing post-assessments for my program. So healthy snacks were a big hit at my first session. I led residents through a progressive muscle relaxation exercise, and there's time for socializing. In the post-assessment for this first session that was held last year, people really enjoyed the food and the time to socialize with other residents. We're always there sort of working together in the workroom, but I think the time to really focus on people as people and not just as colleagues is important. So year 2, I'm happy to say that the program has continued to expand. There's been a lot of departments of support for this as well, including a Healthy Snacks cart. It was probably one of the best days of my residency when my program coordinator rolled in this cart of all these healthy snacks that I advocated for. And so they refilled those, I think, once a month or once every 2 months. Residents really enjoyed that. And so things like LaCroix, V8, healthy snack bars, so that way if you're too busy for lunch, there's at least something nutritious to have. And then in the second session, which I love this spring, we did a gratitude exercise and guided imagery. And then I also included the medical physics residents as a smaller group of residents, but it was great to sort of have them included as well. And then just some lessons learned was kind of interesting initially when I implemented this in my pre-assessment and post-assessment. People had thought, oh, we really don't want something outside of work hours. We already give so much to this program. There's really no space for that. So that's why I led these initial sessions sort of during one of our required lecture times. But then what's interesting is things sort of changed in the second year. People said, oh, we do want happy hours and things after hours. So that's sort of the direction where things are going. And so we have done happy hours, included the medical physics residents as well. And it's actually something that one of our chief residents now is sort of helping take on as and leading these monthly wellness events. That's actually now been funded through our residency program, which is great. So these are things that are after hours that have been fun. Also, I don't know if anyone else is planning to go to Society of Integrative Oncology, but one of my faculty mentors and I actually submitted to do a wellness workshop there where we'll be doing some of these wellness activities, and that got accepted, so we'll be going in, I think, September of this year to New York. And then one other initiative that I'm really excited about, I think a lot of wellness and sort of wellness initiatives focus on burnout, but the other side of it, I think, is restoring joy in medicine. And one of the things that I'm excited about that's been funded through my program as well is something that I'm calling the Round Reflection Round. So this is similar to Schwartz rounds, if anyone knows about that, but this will be adapted to an oncology team. And so This will be a quarterly event where we'll feature a panel of providers, including a trainee, someone from a different oncology specialty, and we'll feature a certain patient or certain patient theme and sort of have a panel discussion about that, and then have a full discussion as well. I think it's just a way to celebrate each of the contributions that we made, particularly in radiation oncology, having dosimetrists, medical therapists, physicists, sort of the whole team coming together and sort of celebrating how each of us contribute, and also remembering patients who have passed away but still had meaningful impacts. So thanks so much for listening, and happy to take any questions.